Welcome to this explainer. Let's jump straight into it, shall we? What if managing a clinic visit was literally as smooth and predictable as booking a movie ticket? Today, we're unpacking a system that tackles one of the most universally frustrating experiences we all share. You know the one, the absolute chaos of clinic waiting rooms. We've all been there, right? You're just staring at the clock, wondering when on earth your name is going to be called. Well, today we're looking at how the Qpulse platform is stepping up as the modern healthcare operating system to completely eliminate that stress. Section 1. The waiting room crisis. Let's look at why this is such a massive problem. We're all way too familiar with the old way of doing things. You've got unknown wait times, scattered paper records, and predictable delays that honestly just frustrate everyone, patients and those overloaded clinic staff alike. Qpulse flips this entire dynamic on its head. It replaces all that anxiety with live tracking, totally predictable queues, and a connected patient history. It's all about finally taking the guesswork out of healthcare visits. And the heart of this entire platform is captured perfectly in their slogan, "Skip the wait, stay in the pulse." That's the ultimate fix they're offering. I know, it's a bold claim, but as we're about to see, they actually back it up by connecting the entire healthcare ecosystem into one real-time network. So here's our roadmap for the explainer. First, the waiting room crisis, then the patient journey, followed by the real-time provider workflow, digital health records, and finally, enterprise control and analytics. Section 2, the patient journey. Let's step right into the patient's shoes for a minute. The journey starts with a super clean, minimalist interface for patient discovery. It's incredibly intuitive. You can effortlessly search for nearby clinics, filter by your city, or just jump straight into specialties, like finding a general physician, a cardiologist, or a dermatologist. It literally eliminates the stress of hunting down the right doctor. There's even a quick access section for your recently visited clinics right there at the bottom, so rebooking is a breeze. Once you pick a clinic, you're greeted with this brilliant movie ticket-style booking setup. You can choose a standard walk-in visit or go for a video consult. And here's a real game changer. If you choose telemedicine, there's absolutely no app to download. It's a zero-install call right in your browser. Plus, to make sure the care is top-notch, the system enforces mandatory digital e-prescriptions before the video call can even conclude. You just punch in your name, age, and what's bothering you, and boom, the system assigns you a live token, complete with an MSG91 SMS alert for when your turn is coming up. It really is as smooth as picking a seat at the cinema. Now for in-person visits, a physical QR code at the clinic's front desk bridges the physical and digital worlds beautifully. You just scan it with your phone and you instantly join the live queue. Your phone turns into a live tracker. It clearly highlights your token number, tells you who's currently being served, and shows exactly how many patients are ahead of you. This live queue syncing means you know exactly when to arrive, so no more sitting around in a crowded room full of coughing people for an hour. Section 3. Real-time provider workflow. Let's pivot over to the clinic staff and doctors. If you're working the reception desk, the live roster and token console is basically your command center. Staff can effortlessly manage the flow of patients, track the waiting queue, and pull up medical histories. And privacy is absolutely paramount here. When a doctor requests a patient's historical medical timeline from the network, that access automatically revokes the very second the checkup ends. When the staff marks an appointment as complete, the entire queue dynamically updates for everyone, instantly. It all boils down to a brilliantly simple 3-step flow. Step 1, the patient generates a token on their phone or by scanning the clinic's QR code. Step 2, the clinic's live roster updates dynamically in real time. Nobody has to manually type a thing. Step 3, the doctor sees the patient and simply marks complete visit, which advances the whole queue. It keeps the clinic floor moving smoothly without the usual chaos of someone shouting names down a hallway. Section 4, digital health records. How does Qpulse actually handle all this sensitive medical data? Well, you get a DP-compliant health card that holds critical info like your blood group and allergies. There's also an incredibly smart emergency QR code built right in. If something goes wrong, first responders can scan that to instantly retrieve your primary vitals. And beyond emergencies, the visit history timeline lets authorized doctors see your past visits, chief complaints, and the exact medications you were prescribed at different clinics across the entire Qpulse network. Now, we all know a major hurdle in health tech is forcing doctors to change how they actually work. Qpulse is smart. It doesn't do that. It offers incredible prescription flexibility. Doctors can type out native digital e-prescriptions if they want to, but if a doctor prefers writing on their traditional paper pad,
No problem. The system allows doctors, or even the patients themselves, to seamlessly upload and digitize those handwritten notes, while also keeping all your lab reports consolidated in one place.
It bridges the gap perfectly. You can have a fully digital e-prescription sitting right alongside a photo of a traditional handwritten pad. And how does it get there without making patients log into clunky portals? QPulse uses a Twilio WhatsApp bot. It delivers the prescription directly to the patient's WhatsApp. If the doctor writes a physical note, the bot literally just prompts the patient to reply with a photo of it, and boom, it's digitized instantly. It is so user-friendly. Of course, accessibility is crucial. That's why QPulse uses dual login recovery. They replace easily forgotten passwords with a simple, secure OTP login via your phone number. By setting up a recovery number, you ensure you never lose access to your critical health records, even if you upgrade your device or change numbers. Your data stays with you. Section 5. Enterprise Control and Analytics. Let's zoom out and look at the big picture for hospital administrators. For enterprise scaling, the SaaS admin portal is basically the ultimate command center. If you own a hospital network or a chain of clinics, this dashboard gives you absolute centralized control. You can oversee active clinics, track patient volume at the waiting desks, and manage which staff members are authorized to do what. Adding new clinics or branches to scale your operations is practically effortless. And here is where it becomes a real superpower for administrators. Multi-tenant consolidated analytics. This isn't just about managing the waiting room flow anymore. It's deep business intelligence. Admins can track aggregated revenue across all combined clinics and monitor total roster bookings. Most importantly, they can keep an eye on network-wide queue delays. If the average wait time suddenly spikes, management knows immediately that there's a bottleneck, and they can audit performance down to the specific room and physician. Plus, for the enterprise IT teams out there, QPulse is built to be highly extensible. Administrators can generate private API keys to authenticate REST requests. This means existing hospital apps can seamlessly pull live queue statuses directly into their own tech stack. It plays incredibly nicely with whatever broader enterprise environment you already have set up. So we've seen the entire ecosystem end to end, from a patient seamlessly booking a token on their phone, to the doctor easily managing the live roster, all the way to the administrator analyzing network-wide revenue and wait times. The technology to finally skip the wait and stay in the pulse is already here. So I have to leave you with this question. Are you ready to bring your clinic's workflow into the real-time era? Thank you so much for joining me on this explainer. Keep learning, and I'll catch you on the next one.